Digoxin, or the generic Lanoxin. It's actually a cardiac glycoside, and it comes as 0.625 milligram, or excuse me, 0.0625 milligram, 0.125 milligram, 0.25 milligram tablet, as well as a solution, and it also comes in an injectable form, which would be used in a clinic or the hospital. It's used for heart failure, and as I said in previous videos, not as much anymore because we have better drugs. It's also used for AFib and off-label, which when I first started it wasn't off-label, but for supraventricular tachycardia. This one actually goes back to the pharmacognosy days, which I asked Amanda. She didn't even have that class, but I had that class. And it relates to plants and how pharmaceuticals are made from plants, because it comes from a plant, Digitalis purpurea, which is foxglove. And it is a very dangerous plant, and this drug can be a very dangerous drug. It has a very small therapeutic window, which means if you have too much, you're going to have toxic effects. If you have too little, you're not going to get the benefit. So you really need to watch your dosage, if you miss dosages, and with drug interactions. And it does have a lot of drug interactions. Talk to your pharmacist about that. With this as well, if you have poor kidney function, you want to be on a lower dose too. As far as side effects, you can see things like headache, dizziness, abdominal pain, nausea, vomiting, diarrhea, weakness, rash, depression, anxiety, even confusion. It can cause bradycardia, which means slowing down the heart, which is ideally what it's supposed to do. But it also can cause tachycardia, which means that your heart's going to race. You can also see palpitations with it, so be aware of that. If you have any of those, let your provider know right away. You can also see visual disturbances. Something else that we will talk about in a future video is there are interactions with vitamins as well, like vitamin D and calcium. So you want to be careful with that because you can get toxic levels with that as well. So talk to your pharmacist or provider about all medications and supplements that you take.